name is Robbie Omondi, and this is Life 360.
Kama kawaida, this is your health communicator. Today is no different. We are talking about a topic that needs to be spoken about more often. This is about contraception. Most of the time when you mention this topic, people will assume it's about the ladies. Let them take care of let them take the medicine, let them make sure that they're taking their contraceptives. But again, it is a conversation that we need also to include the men, so that when you're making these decisions, we're making decisions as a couple or as a family, or you're making a decision together, maybe with your sister, so that you're informed and you can advise them better. I'm not alone, I'm not an expert, so I'm joined by an expert who will be helping us to talk about this conversation. I'll let her introduce herself, take us through this particular topic. First of all, thank you so much for joining us today. So for my viewers, who are you? What do you do? Where can we find you? And then now we can dive into the conversation.
Thanks, Ruby, for having me today here. My name is Vivian Magara. I'm a registered nurse. Currently working at a fertility clinic where we do IVF. You can find me at the clinic where I work, or you can reach out to my number.
Perfect. Today we'll not talk about IVF, but it is a topic that I'll call you again so that we talk about it. Most people don't know about IVF. Most people are not aware that there are other options of conceiving when you can't conceive naturally. That's a tip I've given you. But for today, let's talk about contraceptives and contraception. Tell us about contraception.
Okay, contraception or family planning. It's a method or medication where we give to couples or someone who is not ready to start a family, at least to prevent the pregnancy from happening. So it helps in managing the family or the number of children maybe a particular individual might need to have. Yes.
But again, this is a conversation that Kitambo, or in the past days, it wasn't an easy conversation to have, either between women, between a parent and a daughter, between a father and a daughter, or even amongst peers. And if it happens amongst peers, that is where peer pressure came in, and you find Robbie is taking a certain family planning because a friend of hers is taking a similar family planning. So what are the various family planning methods that we have?
Okay, thank you so much, Ruby. So we currently have a number of family planning, where as women, men, we have limited options where we can choose from. I like to, they're put in groups. So maybe I can start by listing them, then I see the side effects, the effects, who can use them, and who can't use them. So let me start with the common ones, the ones you know, the ones which are easily available. Even some of them you can just easily find them over the counter. You don't need like a professional or unhealthy personnel to prescribe for you. So the first one I can start with, these ones we call combined oral pills, COCs. So the combined oral pills, these ones, they contain hormones, both progesterone and estrogen. Yes. So the hormones on it, their work is just to prevent the pregnancy from happening. So in a natural cycle, when a woman is to conceive, there has to be formed a egg in the ovaries. Then once she's on mid-cycle, she will ovulate, and maybe if she has intercourse at that time, the egg will meet the sperm, and fertilization will occur, that's pregnancy. So for the family planning, they work by preventing the egg from ovulating. Yes. So this egg will not ovulate and move all the way from the ovaries through the fallopian tubes to the uterus for fertilization. Yes. So the hormones for this family planning, they are classified according to the hormones they contain. For example, the combined one, I've said they have two hormones. That is the progesterone and the estrogen. Yes. And then we come with there's one called progesterone only pills. Now these ones, they only contain the progesterone. The work is still the same, just to prevent the egg from being ovulated, for it to go and meet the sperm. It also helps to thicken the cervical mucus in the cervix, at least to prevent or to block the sperm from reaching the uterus for fertilization. Yes. So I've talked about two. Yeah, the separate ones, the hormones. One has both estrogen and progesterone, and they had this one now with only progesterone. Now those are oral contraceptions. Yeah, the one you can just pills.
Just pills.
Yes.
How do we take these pills? Because most of the time there are people who don't know. There's others who have myths. I hear that I don't know if it's the oral pills, you shouldn't take after taking alcohol. Others you should take before 24 hours or 42 hours after you've had intercourse. How are they taken? What is the right way to take these pills?
Okay, thank you so much. So for the pills, it's advisable for if you are to go for the pills, you really have to be very consistent with taking the pill, because they're daily pills, and you should take them at least the same time of the day. So the effectiveness of the pills will work if you are really consistent with the time and every day. Yes. So if you are taking it at night at 8 p.m., let it just be 8 p.m. at night. Okay. Yes. And if you miss any, you have to take it immediately when you remember. Okay. So the effectiveness and the failures of the pills will determine with the individuals who is taking the pills. Yes.
So that's for the daily oral pills.
Daily oral pills. Ideally, they come in packs. There is a pack of 21 packs, and there's one for 28. Yes. So for the 21 pack, you just take every day for 21 days. Then you'll start another pack immediately. There is no stopping. Then for the 28 days, you'll take the pills for 21 days. The next one, it contains the folic. So that period for the folic, you will get your menses. Once you finish, then you start another pack, or rather you can skip the folic acid in that pack. You wait for 7 days, then you start another pack after now you've finished your menses.
What is the purpose of that folic acid, the tablets now that are containing that have folic acid?
Okay, for the folic acid, we I'm not saying all. Some of these women who take the pills, they tend to have heavy bleeding. Yes, so for the heavy bleeding, they tend to lose a lot of blood, and they might result to like anemia. So the essence of taking the folic acid is at least to regulate the blood and restore the lost blood. Yes.
What about now these pills that are only taken after one has had intercourse?
Okay, now that's another method of family planning, which we call emergency contraceptives, or the P2s, the most commonly used name outside now for a common mwananchi. So the emergency contraceptive, they are taken for like, I could not advise someone to take it daily as a method of family planning, because they're just for emergencies. Yeah, so these ones will just prevent pregnancies which maybe you have had intercourse and you are not on family planning and you don't want a pregnancy. So that's when someone can go for emergency contraceptive. So this one is taken after intercourse up to a maximum. Let's say you have intercourse today, you can take it even up to 5 days. It will prevent the pregnancy. Yes.
Now, let's demystify some of the misconceptions that come around, especially the emergency pill. You've mentioned one, you said you wouldn't advise. Tell us why and what is the mode of taking, because there are people who take before, maybe after, and what are the dangers that surround this particular contraception as an emergency pill?
Okay, maybe I'll call them misunderstandings. Yeah, because I can't, like, there's no myths. Let me call them misunderstandings because there's a lot of, let me say, saying like I took the pill. You can hear it from a friend.
Yeah.
Yes, maybe I took the pill and did this to me. So it depends from one person to another.
Yeah.
And for emergency contraceptive, it only works after the sexual intercourse. So if you had a sexual intercourse today, you have taken the emergency contraceptive today. Let's say you have it again tomorrow and protected sex. So the pill you took today, it won't help for tomorrow. So it works for just that intercourse. If you had intercourse today and took the emergency contraceptives today, let's say you again have it tomorrow, you have to take another pill. So imagine, that's why I said I would advise someone to rely on emergency contraceptives as just a normal family planning, because one pill of emergency contraceptives, it's made of up to 50 pills of the normal COCs.
What?
So if you don't get the emergency contraceptives, you can take the oral combined COCs, but you have to take 50 tablets to adapt the dose of just the single emergency contraceptive.
Wow.
So it has a lot of limit. The dosage is very high. Yes.
In one tablet.
In one tablet. Yes.
Wow. Okay, so because of that, and we really know that there are many young girls who rely on the emergency contraceptive instead of going through now the daily pill that we've spoken about earlier. What does that mean, and what are they pumping into their body if you're taking this particular pill every single day, or as many times possibly as a week?
Okay.
Or even in a month? What does that mean?
Thank you so much. So for emergency contraceptives, the only risks I can say it's that that consistency of taking the pill now and then, and sometimes you might not even access it. Maybe you are somewhere and you can't even get it.
Yeah.
So it brings these risks of unwanted pregnancies, which leads to many girls now having unwanted pregnancies and going for abortion. Yes. So that's why if you are like sexually active and if you are sexually active, I will advise you to go for just like a daily or a routine family planning method, other than going for emergencies now and then. Yes. And then for the emergency contraceptive, let's say you had your period and you have had intercourse after a week. So if you take the emergency contraceptives, you are going again to bleed.
Okay.
Yes. So how many times are you going to bleed just because of taking the emergency contraceptives? Yeah. If you have, yes,
a good question.
Yeah.
Very true. And are there known effects, like long-term effects of taking, let's say, this particular emergency pill for long without knowing the side effects? Are there like known side effects that actually happen when you do that to your body?
Okay, as per now, I mean, according to World Health Organization, that's WHO, they have no side effect of taking the emergency contraceptive for long, because even the other oral contraceptive, the one I said, the COCs and the POPs, now the progesterone and the estrogen, it's known that someone can even take it for a lifetime. Yes. There's so many misunderstandings out there that when you take, they feel your body, or maybe blood will be trapped inside your body because you might
fail to get pregnant.
Yes, you become infertile. No. Yeah, according to the latest report, there are no side effects of like infertility or blood building up, or you not be able to conceive, because once you stop the medication, even if you take emergency contraceptive this cycle for 5 times, next time your fertility levels will still come back. So that's why they keep on taking, because they will conceive.
Okay.
Yeah.
All right, now we can go to other methods.
Okay,
I don't know
okay.
if we can go to the, I don't know.
Yes, yes. Thanks to
Yes.
the researchers and the providers.
Yes.
So if you can't swallow everyday medication, we have injectables.
Okay.
Yes, yes. So the injectables we call progesterone. There is one we call progesterone injections. Yeah. So the injection, mostly we have one known here like Depo, Proveras, the one for 3 months. This works for someone who thinks, no, I cannot be able to take these tablets every day.
Yes.
I'm not very consistent, because if you miss now taking the pills, you are at higher risk of getting a pregnancy. So if you feel like, no, I can't manage to take daily medication, then the best option for you is to go for the injectables. It's just the same as the pills, it's just that it's now in form of injection. Yes. And most women love these ones because they just go for injection, then that's it. Nobody knows, nobody will monitor you. We are taking medications. You won't have to hide from your partner for you to swallow the pill at night. Yes. So for the injection, that's now where most people prefer it, because we have an injection for 3 months, where someone goes for a shot and they go stay for 3 months, then they go again for the injection. Then we have again for now that's for the combined for the estrogen and the progesterone, just the same thing, but now this one it's for injection. And then we have another one for progesterone only, where it's just for 1 month. You have to go back for the injection after every month. Now with the injection, you have to, let's say you did it 1st of January. So after every 3 months, now for the 3 months, you have again to go at the
every
same
first.
Yes, every first of every 3 months. Maybe now every first of every month for the progesterone one. If you fail or if you skip, now then you also have a risk of getting pregnant. So if you feel like if you missed, you can use a backup method. We have so many backup methods. I'll say them later.
Now for these injectables, is there a right way to have the injectables? Is there a specific place where the injection is supposed to be done? How long after the injection should I have intercourse?
Sure. For the injectables, that one you have to get it from a healthy facility. With a qualified personnel who is authorized to give the injections. Yes. Like for the Depo, that one is given either intramuscular, that's a hem in the buttocks. You can get it on your thighs, you can get it on your arm. Yes. And for there is also another one which has come, which is readily packed for subcutaneous, just below your skin. So for the injectables, that one I can't advise someone to go and buy and then take it from home. So that one you have to visit a healthy facility where they will monitor you, ask you questions, make sure that you are not pregnant before getting the injection. Yes, measure your blood pressure and everything before they give you the injections. They also advise you on other forms they have at the clinic, so that you can make an informed choice.
You know, there's something you've mentioned. What about pregnancy and these injections? What does it mean? And then when you say you have to check your blood pressure, does it also mean that people who are at risk of or have instances where their blood rises or falls do not need to get this injectable?
Okay, so for all family planning methods, I think most women, at least 98%, can take any form of family planning. Yes. And the effectiveness, it depends on the individual, how you will take the instructions. Like now for the injections, you have to go back for another shot immediately after this one it's over. Yes. Let's say if 100 women go for a shot of injection, out of the 100 women, 3 out of 100 might be pregnant while still on family planning. Yes. But now the pregnancy chances reduce when we take these injections the right way, the right time, without missing, and the consistency. Yes. And
what happens now if I'm pregnant and I get injected or I take that particular family planning?
yes. Now, when you go to an healthy center for family planning, the first thing they'll do is to make sure that you are not pregnant.
Yeah.
You are not pregnant before they give you the family planning or the injections. So they might do a pregnancy test, or maybe ask a question regarding your sexual. If you are not sexually active, honestly, then you are not pregnant. Yes. But if it happens, because I've said family plannings are not 100%, there is that 0 point something percent who might be pregnant while using the contraceptive. So you have to check for you not to get like an expired drug. So that one also might increase risk of getting pregnant while on the family planning. So, but you can also even get the right medication and you are even consistent, but you might even conceive. So that one, those chances are there. So, but the good thing is that even if you go for an injection, let's say 1 month, 2nd month you are pregnant, and it is not going to affect that pregnancy. Yeah, any family planning, even if you take the pills and you discover I'm pregnant, there are no risks to the pregnancy. They don't cause miscarriages. They don't cause birth defects. So you just, when you realize that you are pregnant and you are on a family planning method, you just, if it's the pills, you just have to stop. Or if the injection and you took for 3 months, you just have to stop and don't go for the next one. Yeah.
Okay. The next method.
The next one, we have implants.
Yes.
Implants. This one are also hormonal contraceptions, which the good thing with implants, it's that they last for long. They can give you protection. There's one for almost 10 years, another one for 12 years, there's another one for 5 years, there's another one for 3 years. So the implants, you can see women having it here on the hand. Yes. So these ones, they are also hormonal contraceptions, which give long-term protections. I can say long-term protections. So this one are also hormonal. It's just the same progesterone and estrogen, where women who maybe don't want injections, don't want pills like taking every day, or women who like to who like that long protection. Like, let's say you don't want a baby for 5 years. Why could you take pills every day? Why could you go for injections like every month? So the best method for you is for implants, because now this one gives a higher protection period. And let's say maybe you feel like you're done. I have 2 kids, they're enough. I don't want any baby. But you don't want to make that decision of going for a permanent family planning method. Maybe you need some time to think. You can go for the 10 years implants. Meanwhile, as you think, instead of making a rash decision of going for a permanent family planning, which you may regret later.
Yes, all right.
Yeah.
I think that one is almost similar for the IUD, which now I want you to talk about, because now it's almost a similar situation.
Yes.
Now you can tell us about the do's and don'ts.
Yes. Now we go to IUCD. So this one it's also a long term, and it's the most effective contraceptions we have. Yes. And this one I can recommend it to any women because it doesn't have hormones.
Okay.
Yes. It's non-hormonal. It's non-hormonal.
Okay.
So if you have tried all this other family planning and they're making you maybe gain weight, you see they're making your cycles fluctuate, like maybe you're now having a higher menses or no menses at all, or you're bleeding in between your menses, it might be very uncomfortable, or it might even cause anemia. Yes, that tired, nauseous, headaches. So you can go for the high UCD ones. So it's a copper T, which has no hormones. This one has to be done by a qualified doctor or a nurse or a midwife, because it's inserted and then it stays in place. So the work of this copper T is just they release some harmful substances which kills the egg or the sperm before they fertilize. Yes, yes.
Now, I want to understand what happens to a woman's body when they're using the hormonal family planning methods.
Okay, so it depends. It ranges from one person to another because we women, we are different. Yeah. Whatever might work for you, it might work for me, and whatever might not work for me, it might work for you. Yeah. So for family planning, we advise women, at least when you visit like a health center, they will give you all the options. Then they give you, they discuss. So the hormonal ones, I said they have both estrogen, progesterone, or one has a progesterone without estrogen. So those are like our normal hormones we have as women naturally in our bodies. So there is nothing much we're introducing again to our bodies. So the risks or the factors are very minimal. Yes, yes. For example, the only thing which has been associated with these family planning methods, especially the hormonal ones, are now the issues with menstruation period, where maybe when you are starting a family planning, you might see changes in your menses, in your periods every month. So some experiences very scanty, some longer menses and heavy, or some may not even get menses at all. There's no issue. Even if you are not getting menses, it does not mean that now those menses are inside your body. They have accumulated. No. The reason why you are not getting menses while on family planning, it's because the ovulation is not taking place. And when ovulation is not taking place, meaning your lining, which is shedding when you are getting menses. When you get menses, it does not come from the ovaries or wherever, or the egg has ruptured. Now it's shedding. We shed the lining. Yes, the uterus lining. That's the one which sheds. Then we get our menses. So when you are on family planning, you are not ovulating, because these things work in one way. They are coordinating. When an egg is forming, the uterus, it's also thickening, ready for pregnancy. So if you are not ovulating, meaning your lining is very thin. So if the lining is very thin, there is nothing which is going to shed. So the lining has to build for it to shed during menses. Then now we start a new cycle. That's why we call them cycles. Now it will start, once it sheds, it becomes very thin, then it will now start again building for shedding next month. But if you are on this family planning, your lining is thin, it's not growing, so it can't shed. Yes, so that's why we are not getting menses. So there's no problem at all. Yes.
So it means biologically speaking, there's no effect when a woman is not bleeding or is not having that.
Yeah, there is no effect. So if you feel like, no, I'm a woman, I have to get menses, then this hormonal medication, maybe if you have used N and you are not getting menses, and you feel really bothered, so you should just change it. Yes, yes. But there is no harm, there is no blood building, there is no infertility coming. Yes.
All right. When we hear of stories that I got pregnant even while having my IUCD, yet it is the most effective method. Zingine unasikia a child was born holding that
the IUCD.
What happens in those instances?
Okay, so the first thing you should know about IUCD, I said you have to get it from a very professional personnel. Why? Because a specialized personnel will know the right way of inserting it. Because the IUCD, it's inserted up to the uterus. Yeah. So if you go find it somewhere cheaper, maybe this the clinics, let me not too much. Yes, if you get it from a quack personnel, a quack doctor who doesn't know how to put it, well, then you come and maybe you're having intercourse, it might even move. It might move or relocate, and so it's not in the right place. If it's not in the right place, it's not doing whatever it's supposed to do. So that way, you are more likely of getting a pregnancy while on it. Yes, yes.
Now, there are people who say, I don't know, let me be the bearer of this news. There are people who say that when you're going to get, for example, the IUD, you have to go with your partner so that the doctor has to measure the size of your partner so that you know how far the IUD should be put. Is that true?
No, that's not true.
Okay.
Because for IUCD, the only thing we emphasize on when putting an IUCD, it's infection.
Okay.
If you are someone who is recurrently having infections, STDIs, so you are not likely to have the IUCD, and even we can't advise you to go for that option because IUCD, even the process itself of inserting, if you have already an infection outside, the IUCD might take it up to the uterus, and you are now going to get like a peripheric PID, we call it peripheric inflammatory diseases. That's a bad infection which might even result to infertility. And if you know that your partner has an infection, you as a lady, you should tell your health professional that my partner has an infection or my partner is not faithful, if someone maybe has multiple partners, so that one IUCD is not for you.
Okay.
Yes, because it has higher risk of in making or increasing the infection. Yes, yes. And the size, IUCD comes in just one size.
Okay.
Yeah. And the way we put it, maybe some women say, I've had stories also here that it's very uncomfortable when you are having intercourse or whatever, or even all those vigorous exercise during intercourse might even relocate it. So you have to keep monitoring the strings. That's why when they're putting it, there are some strings which are left hanging through the cervix to the vagina. That's why you have to, at least every day, you have to see them, knowing that it's in the right place.
All right.
Yes,
so
yes.
basically what you're saying is it's not how it's put, because again, if it's put by a professional, it means it's in the right place.
Yes.
Ni vitu zenye watu wanafanya.
Yes, ni vitu zenye watu wanafanya. That's why you have to go for regular. You see, I said it's a long term.
Yes.
It can stay up to 10 years, 12 years. So you have to go like normal clinics, normal follow-ups, at least to check if it's still in the right place, or if you feel anything, if you feel uncomfortable, you're free to go back to your professional, the doctor who put it, and maybe check if it's in the right position.
Yes. Maybe we can talk about now the permanent family planning methods.
Okay.
Yes.
The permanent ones, we have two. Now for the permanent ones, this is where we bring men in.
Correct.
Yes, for the permanent ones. So for ladies, the permanent ones, we have one which is called tubal ligations. Yes. So this one, it's where maybe you as a woman, you have had your kids and you think like, no, I can't go for these family plannings. I'm done having kids. I think I'm okay. Yes. So let me just, you sit with your partner or you yourself and decide, let me have this permanent, let me tie my tubes. Yes, or maybe for the cesarean section, or maybe any condition and your doctor has advised you, you can't have more babies. So the only option you have to avoid these unwanted pregnancies again and miscarriages and abortion, so you have to go for a permanent contraception. This one is called tubal ligations, where you go, it's a surgical procedure where they tie the tubes. Some might tie them, cut and tie, or just block them, because the tubes is where the egg is going to travel from the ovary through the tubes to the uterus for fertilization. So if you tie the tube, there is no way this egg will move from the ovary to go to the uterus to reach sperm for fertilization. Yes. And when you are going for that permanent the tubal ligation, you should know that it's not reversible.
Wow.
Yes. So
Okay.
you should, when you are getting such a patient, health providers, you should at least cancel.
Advice.
Yes, cancel these patients, because I've seen where I work,
Yes.
in my clinic. Let me come to my clinic.
Yes.
Yes. So life happens. Maybe you have your 3 babies, you have your 2 babies, and you say, I'm done. Then life happens. You lose maybe one, or you lose both of them, and you are like, hey, now I need a baby. So some come, they say, no, I did my triple irrigation, but I want a baby again. I have tried to reverse it. It's not reversible. That's why we call them permanent. So if you feel like in future you might want a kid, don't go for the permanent. Yes.
Is there any other permanent one? Like I hear people say you have to remove the womb or something like that.
No. For the permanent one, for family planning, now removing the womb, now that's one. It maybe if you have any other issues related to the uterus. But for the permanent one, once you block the tubes, there is no way you are going to conceive. Although it's also not 100%. Yes, it's not 100%, but the chances of conceiving are very minimal. Yes. For men, this is where men come in also to support women.
Yes.
So if you feel like your woman is tired of taking all this family planning, and they are affecting her, and you can help. Also, men choose to take it and go for a vasectomy. So what we do in vasectomy, they block the tubes, which takes pumps for ejaculation. So it calls for deference, where they block it, they may tie it, or burn it, or they use electricity to burn it, so that there is no connection from the testis through the tube for them to ejaculate sperm. Yes.
I know people will be afraid. My director is wondering how use electricity, and when you're talking to men about such matters, they're so afraid. I will bring someone here who will talk to us about vasectomy, so that men are not afraid. It's an invasive procedure. Apparently, it takes a few minutes and you can go to work immediately.
Sure.
Don't look at us with some purple eyes as if it's something.
So it will depend on what your doctor will decide on. Yes. There are so many ways to block. So I said they can tie, they can burn, they can also use electricity to cut that connection. We just want to cut that connection. So when a man maybe is having intercourse, there's no sperms in semen. So it's also permanent, but your wife can conceive. It's not permanent. It's not 100%. Yes. That's why you, like the first time after doing it, your doctor can advise you to at least do a semen analysis now and then to check whether the semen has sperms. Yes.
What she means is that you still ejaculate.
You ejaculate, but now the semen will not have sperms. And maybe if your wife conceives and you did a vasectomy, some men go do it and they don't tell their wives. Then they wait for her to conceive. Yes. So it's not that she's being unfaithful. You can go back to the doctor and maybe get advice. And we also have many family planning methods. We have the natural ones, like we have condoms, male condoms, female condoms. The good thing with condoms is that it protects both the pregnancy and also these infectious diseases, STIs, HIV/AIDS. So, and for the male condoms, female condoms, if you feel you can still use them when you are on other family planning. Let's say you are on pigs and you missed like 2 or 3, or you traveled and you forgot the pills in Nairobi. You are in Kisumu, you forgot the pills in Nairobi, and you can't even, where you are, you can't access. So you can use a backup. That's what I say. Which backups? We have the condoms, we have diaphragms, we have spermicides, but you should know that the diaphragms, withdrawals, these are the least effective family planning.
You may insist, Kweli.
Yes, the least. The least ones, I've said the two, spermicides and the withdrawals.
What is spermicides?
Spermicides, it's a cream where women put it in the vagina. Yes. So they have like a toxic where they destroy sperms when they come. Yes.
How is it put and how does it work? Because I'm also learning. I didn't know about it.
Yes. So this this one it's for women. They put it in the vagina.
It's a cream.
Yeah, it's a cream. You insert. Yes, you insert.
Okay.
Yes. There is it comes with a way of inserting or
it has directions.
Yes. To insert, you can bend, insert. You can squat. You can lift your leg, then insert.
The same way you put in like a tampon.
Like a tampon or like a medication, those pessaries, the medications. Yeah. So you just put it. It acts like a backup. Maybe you are somewhere you can't get a condom. You're somewhere you've forgotten maybe you want to go for your appointment to get another injection, but you can't make it on time. So you can use this one as backups.
Is it effective? How effective is that?
They work, but I've said they're the most least.
Okay.
50-50.
50-50.
Yes, both the withdrawals and the spermicides. We also have ones which called patches. So this one is a form of family planning. It comes in form of a patch where you just peel and you can put it anywhere. You can put it in your thighs, you can put it in your arm, you can put it in your back, you can put it in your stomach. So this one, it also releases hormones which prevent from pregnancy. So if you don't want to swallow, if you don't want, it's new in the market. I'm sure most people don't know about it, but you can find it in these the hospitals. So it's a patch where you just peel and put one patch. You put it. You keep changing it after every 1 week. You put the first week, second week, third week, the fourth week you rest. Then now you start that the week you are resting, you get your periods. After they're finished, then you start again another one.
Wow. So it's a patch that you just put.
It sticks. It stays for 1 week.
1 week.
You change after every week.
Okay.
So you can shower with it, you can swim with it. It can't come out.
Okay. That's new. So when a woman visits a health facility, and now let's talk even about young people. Right now, we are having young girls as young as 9 years, 10 years having intercourse.
Yes.
Would you advise for these services to be available to young girls?
So for family plannings are available to any individual who is above adolescence, any person who is sexually active. Yes. Yeah.
Now, when I visit a health facility and I want, because people, even me, I'm learning some things from you. I have been to a gyna before. I have used a particular family planning methods.
Sure.
Would you say most health practitioners advise and give this range of family planning options to women who visit facilities before they decide on what is good for them?
Yes. So the latest report shows that almost 120 million people worldwide seek these services. In fact, this is the highest services people seek in hospitals, because we are not all sick from malaria. We are not all sick from typhoid and whatever, but we all need family planning. So the only issue is that mostly you get that these services are not available, or where you go in your nearest clinic, your nearest hospital, it doesn't have all the options. So maybe the supplies are not enough, and also these side effects, the misunderstandings, people are passing from one person to another, the risks, and also availability, and also qualified people. Like you can go somewhere and you can get that they have like implants, but there's nobody who knows how to insert it. So they will not going to. They just force you to take the oral medication, and you don't want it.
And or maybe they'll just get someone any doctor
to just fix
put
it, and yeah, to just put it, and when you reach at home 1, 2, 3 months, it has just come out.
Okay.
Yes, so it's advisable that at least like to maybe people to give like these health educations or these forms of family planning, so that people, and also make them available. Yeah, even in the rural health clinics.
Okay.
Yes, yes.
Okay, and now maybe you can give a parting shot when it comes to generally about contraception and family planning.
Okay, so for family planning, as I said earlier, these are the medication. It's I can say like anybody can take them. Yes, yes. Any man, any woman can take the contraception. Yeah, and they are mostly the side effects or the misunderstandings outside here. They don't cause infertility. They're not going to cause you cancers. In fact, most of the contraceptives, they protect from these uterine cancers, the cysts. Yes, yes, they protect.
Okay.
And if you feel like you don't want unwanted pregnancies, I don't want to say much about whatever I've seen in the clinics, because we get like that coming in. No, me, I don't want. I got a pregnancy. I don't want. Who can I sell the baby to? So please, you can protect yourself from family planning. I mean, there are no much side effect you can get from family planning than which one, the ones you are going to get now from unwanted pregnancies, abortions.
And squeeze people now practice unsafe abortions. When they come to a clinic and you're like, you're 7 months pregnant, why do you want to have an abortion?
Yes.
Most women, especially the young girls, end up having unsafe abortions. So I think you have a point.
Yeah, and most of these, like the pills, the ones I said, this one you can get locally, you can just get them over the counter. They're easy. You don't need like a healthy professional to tell you how to take them, or just they do not require technical way of using them. Yeah, and the injection one, you just get a jab, then that's done. Yes, yes.
Yeah. So thank you so much, Vivian, for coming through. And the reason why we are having this conversation is because September we're having International Contraceptive Day, and it's important for all of us to learn about contraception and family planning methods that are available. And for women, you have a choice. There are a variety of methods that you can choose from. Your body is your choice. If you have a choice over your body, if you have a partner, talk to them, make them understand why you're making a certain choice. It's because you understand your body better. And when you visit a health facility, make sure to explain to them about your cycle, about the effects you feel. What do you go through when you're having your menstrual cycles, so that they can also advise accordingly. Thank you very much, guys, for tuning in up to this end. Thank you very much, Vivian, for joining us. Usiende sana, tunakutafuta. Thank you guys for tuning in. Follow us on all our social media platforms. A shout out to all our partners. We'll tag them down below. My producer, my director. It's been amazing. Until next time.